Welcome, Kelly. We'd like to go around and do some introductions real quick, and then organize a couple of remarks before we get started. And with your introduction, why don't you talk about one thing that you're really excited about in BCPH this year? So I'm Lexi Nolan. I use she, her pronouns. I'm the executive director at BCPH, and I am excited about finding how we can gel all of these moving pieces that we've got going now to create a whole organism again.
Wow. Okay. That was good. I'm Indira Gujaral. I use she, her pronouns. And I just am excited about this new role and working with such incredible people. We have so much talent in this agency. And so I'm excited to support people and see how they flourish this year. So
I'm Daphne McCabe, Family Health Division, and I am excited because I always think times of crisis, like all these budget conversations, bring opportunity, and to me, it's driving a really deep understanding of what we do and where our values are, and that's exciting to me.
Yes. Joe Balanowski, he and his serves the Environmental Health Division Manager. I think I'm really excited about some more research work we're doing, which is kind of new for environmental health, which is some community outreach around the Valmont Power Plant, which is a really great case of where we should be. We're doing some work to help that community get organized around some environmental issues and that cleanup that could affect them. So I think it's cool work that we're doing. So thank you. Welcome.
I'm Heather Craig. I use They've Been Theirs. I'm the Community Health Division Manager. Something that I'm excited about. We are doing a lot more cross-team collaboration within the Community Health Division and working on rolling out a really awesome youth power social justice and action framework across the division that I'm excited about.
Cool. I'm Morgan McMillan, she, her pronouns. It's been a wild ride in public health the last several years. So I am excited about the opportunity of, strengthening and stabilizing the organization. And I think we have a great team of folks, both on the board and on the staff. And so I think really finding our center strength is exciting.
Similar. I'm Landry Fagan, her pronouns. I feel similarly like our work has been hijacked by certain priorities that took precedent over everything else, and I'm excited to be able to do more public health and get more involved in the organization outside of leadership changes and COVID.
Yeah, same thing. Brooke Harrison, same thing. I think this will be a great year of stabilization. I think this department will come out of this year much stronger. And part of that is I'm looking forward to the budgeting. I think once there's a good solid budget in place, I think it'll really alleviate a lot of stressors.
Amber Johnson, I use she, her pronouns. I am still in my first 6 months, and I'm looking forward to continuing to learn just how expansive the programming is for BCPH. I think I had a pretty relatively narrow view. Every time I see a presentation, really excited about the work that's being done. I'm Desiree Kazarosian. I'm the finance manager, and I use the she, her pronouns. And for me, I'm excited by the amount of change I think that we've been able to affect already. And the amount of responsiveness we've gotten to some of the requests we've had, especially with the county, and also the amount that my team has learned in a short period of time to make all these changes and look at it.
Kelly Hinch, she, her pronouns, and the Strategic Initiative Branch Director. So I'm excited because with the strategic plan, which is something that my teams work a lot on, I think we're in a space that we've never been before. I think we're doing the strategic plan in a way that we've never done before, and I think it's a great step forward for us. I mean, I still think we have a lot of jungle to hack through yet, and so, but we'll get there. And I just feel that it's a space that you all were saying, once we bring all these pieces together, will be helpful in stabilizing, like use word stabilize, because I think we're pretty stable, but decide, kind of like bring our agency to a more solid platform, I guess.
My name is Kevin Ma, they, them pronouns. I'm the Health and Racial Equity Manager. And yeah, I'm just excited to get the opportunity to help guide and lead the agency in centering racial equity.
Hi, I'm Catherine Palmer. I'm your Director of Admin and Finance here at Boulder County Public Health. And for this upcoming year, I think what I am the most excited about is we have our ANF refresh that we're doing, which is a pretty large overhaul of a lot of administrative processes. So we're getting ready to roll that out and really excited for all the work that the teams have done and put into that.
Hi, everyone, Jordan Thomas. I'm the Business Operations Manager. I use she, her pronouns. I'm really excited because my team is actually full and complete. And as we were onboarding, a lot is going on. There's been a lot that my team accomplished in the last year that we get to build off of. So I'm really excited to see where that goes and to move more into reactionary questioning if things have already been built, but like the answer can be yes, it has been built, and now we get to move forward and improve on it. So here's 2024.
Patrick Cannell, Administrative Assistant, working with Jordan. I am on, and he, him. I am on day 3, so I don't know what to be excited about yet, I think. But
Day 4.
Day 4. Be excited about day 4, yes, okay. Yeah. But yeah, just excited to be really just part of public health and such an important group that's doing really great stuff. Excited to learn more about that. Thank you.
Great. Morgan, did you want to say anything?
I think just again, reiterating that this is a fantastic team of folks and we're under great leadership and it will, it's not that the bumpy times are over. Like, I think we still have some hard challenges in front of us, but I feel immense confidence and appreciation for all of you, the staff and my fellow board members, that we are all in this together and got good stuff coming. So thanks to everyone for sticking with us too, sticking with the organization and the community, because it really comes down to, we are all in this for our community and making the healthier, more equitable place. So thanks to each of you for showing up every day in this work.
Thank you. So I think we have kind of a fun agenda today. We're going to hit some hard stuff first with the budget conversations, but I think it's also a space where we can really deepen our understanding of what's going on in the budget and think proactively about like, how do we want to shape the budget in the future? We'll also talk about what's after the budget. Kevin's gonna take us through a conversation on health and racial equity, and I think we've done some work on that before. You've heard this conversation before, and what we'll really get at today is kind of what would you as a board like to do in that space? What supports can we provide? Where would you like to take a deeper dive or explore more? And the third major topic is Jordan's going to take us through a review of the bylaws, which haven't been updated in quite a while. And she has found a few spots that might need some updating. And so I think that's going to be a great conversation for you to also think about. What kind of expectations do you have for the board?
Sorry, Lexi, I meant to add just in, why a board retreat. We did a couple of these last year. I think it was really helpful for us to have some time outside of our regular monthly meetings to really dive deeper into a few things. So these items that are on the agenda today are things that we don't always have as much time for in our monthly meetings. We're on a tight time schedule, so we can dive in a little bit deeper.
And thank you.
As a reminder, these are public. This is a public conversation today. This is a public meeting. So,
and then Lindy is going to call in when she pops on. I'll bring her to the screens.
Do you want to do the mentee?
Do we need to do the mentee now or come back to it later?
Whichever.
Well, it's up to you.
I think we say we might want to do it earlier, just so we have more time for discussion.
So the question I had is whether, they can do all of the questions if you're not logging in.
I have it.
Yeah, you have to advance them.
I just got my next
We got
one.
the second.
Okay, I have the first one pulled up on. I started it in.
Oh, that was the second.
Mine did not.
Team meter is always fun.
I have it pulled up on mine. Oh, no, I don't. I used to. This is all about flexibility and pivoting, right? That's what this is. So if I click on this link, Catalan,
Yeah.
it brings it up in presenter view for me. And then, let's see, I think I'm still on question one.
Response to the first one, and then it looks like what everyone said, there's some responses to question 2.
Okay,
Yeah, we don't just got some.
Okay. all right, I'm gonna click.
Mine will not progress.
Did you get question 2 though?
Question 2 pops up for me and then it disappears before I can
Me
answer
too.
it.
Mine popped up and then it told me no.
Yeah.
And went back to the original.
What account is this on? It's on your mention.
Yeah,
Then I think you'll have to go into it yourself.
so you don't have. I'll read my name better than that.
There you go. Yeah, go through automatically, but it doesn't always work.
I don't know the question. But it's just like-
That's question.
Wow. Okay, I present again. Okay, so that's question one.
Hold on.
Great. So we're on question 1, and then want to click this button and see if it goes to question 2.
I got question 2 now as a new person.
Oh.
Give me 3 now.
Just as I was about to answer it.
So wait,
Oh, no, now mine went back to question 1 again.
Okay.
I hit 4.
I think it's working.
A bunch of them,
You started, so everybody may have.
Okay,
a bunch of them started with question 2 for some.
interesting. Okay,
That's-
so I should go back,
Yeah.
answer.
We'll be there.
Yes. I hold.
Are we on?
We're on what would you say is your knowledge level in the area of health? Okay,
That's question.
Mine's bad. That's
okay, we're good.
Because if I click it,
Oh, sends me back. Okay, so we're not doing that.
Heather, you don't have to do this. What? You're not doing the mentee.
You're not doing it.
Oh, no, I'm not answering.
Okay.
I don't
You
have
were
it. on.
All right, I have 3 submissions, so I need 1 more.
No, I'm just letting them know.
Yes, that's what
It's glitchy.
Okay, so now I have 4, so I think we're
Okay.
good.
Okay.
4 board members.
Awesome. Okay. So it
Click.
looks like it is working.
And that one, I think this is the one that Daphne had answered too, so we'll, okay, got it. That's fine, Daphne.
this one takes me back. Now I'm back to.
Yeah,
question one
yeah,
again.
I think this must be like out of order, so I'm gonna click to slide 3. So this should be a new question that no one has answered. There it goes, okay, yeah.
It
see?
doesn't give me the right
You're welcome.
options.
Press and buttons. So yeah, after they put, yeah, then you can drive what's the answer.
Yeah, I thought they could answer it without.
I think there's one box.
We answered. Yeah, because.
Yeah.
The first question. Jordan just answered why everybody likes it so much.
Yes.
Yeah.
You got the little magic jar.
The presenter mode or,
Or the feature where they have to go with you.
yeah, it's like some checkbox,
I don't know.
right?
It's a checkbox. You can just take it off
Is that like
and,
a premium feature? I just have a regular.
yeah, we should, yeah.
We have a paid account.
Next question. Almost done.
Oh, yes.
I don't think that we might also open. I'm still on the best for new ones. No, sorry. Every time I go. Gotta replace that button.
With this question, if you can check all that, so you have multiple options.
Like interface, it's very fun.
I know. Like a little proposals. Everyone get a- Right? Everyone get a finish? Awesome. Oh. Next question. This is the last one.
Right. So now I have to replace it. One of my languages. It's your love, so there's it does on my own. Of gifting.
Thank you, everyone. So when we get to the HRE section, we'll go over the result. So thank you so much for tuning.
Just a note before we jump in, I'll turn it over to Catherine, Desiree. Indira and I need to bug out half an hour early to go meet with the commissioner. So you are in good hands, but yes, be on the bad side.
State Morgan and I have very hard stops.
Yeah.
Good chat last hour to meet my sales. So.
Definitely, I have to leave a little early, but it's during the bylaws, so. Perfect.
So we will do our best to stay on schedule.
So now we're going to switch over to item 2, which is budget updates and reserves. We've got different variety of budget information to share with you. I'm just touching on our status, where we are. So Desiree and I have some components, and Lexi will also fill in some extra components. So as we go, let me know if you have any questions, but really just updates to let you know where we are currently. Okay, so looking at our 2023 budget spend down status, we wanted to provide you a look at where our personnel and operating are remaining. So for personnel, overall, we have 1.7 million remaining. That's 9.9. That's just 9% of our budget. From the county perspective, we have 800,000 remaining, and that's 10%. So just to remind you of what those were, with personnel, our overall budget was 20 million. So we're at 1.7, and our overall with county was 7.7 million. When it comes to operating, we have 2.7 million remaining, so it's 39%. And in county, we have 415,000 remaining, which is 60%. Just to acknowledge again, the overall budget for operating was 7.1 million, and the county budget was 695. The reason that the county number is so high right now, just to recall that space, is that this is the component where the PH13 came in, where they wanted us to specifically spend down county funds. We were not set up in the system to do that. We were only set up to spend down salary. So right now, Desiree and her team are working, we have already identified the additional spend down to get this completely to zero, but we have to transition all of those from one cost appropriation to another cost appropriation, and it's a process to do it. So it's slow moving, but the plan is to have that down to zero for the full spend down in 2023.
Sorry, Catherine, I don't think I quite understand what we're saying. So are we saying that we have 9% left for the rest of the year, or 9% that we've spent?
So for 2023 in personnel, we have 9% left of our overall budget. And that's about where we should be.
Okay. To roll into this year.
Yes.
And is that anticipated that that will change as the books close at the end of this month or into March? Or is that like, we normally have about that left over?
I would say we normally have about that left over, because that takes into account, areas where we had, again, with the budget, we're estimating. So we're estimating fluctuations in people's healthcare coverage as well as leave that they take. It could be bonuses that were given. It could also be some vacancy savings. All of those components are coming in. So we do expect a little bit of overage. So personnel is probably where we're going to end up. Operating is the one where we do expect to see a full spend down, especially on the county side.
By the end of, by the close of the budget.
Yeah.
And I had one item on that. We still have the 6 days that are sitting in dimensions for December.
Oh, yeah, that's
So
right.
we do have, it will be a slight bump.
Okay.
Yes.
Thank you, Desiree. Okay, anything else on this one?
How is the county taking into account the remaining funds? For instance, will the department be penalized if the spend down, the rollover is above a certain percentage? Or are they going to accept that 9%, 10% is standard? I'm just curious if we can anticipate additional budget cuts next year based on what's reported for what was in excess.
I'm gonna address that in 2 minutes.
Oh, okay. Thank you.
Anything else on this one? All right, so we want to talk with you next a little bit about some system updates that we are continuing to make to update our approaches and get on this new page with OFM.
So this is the area that my team has been spending a lot of time working. We have spent a lot of time when we do these shifts between the appropriations, it's not as easy as just going into the system and saying, we want to move this to this. We have to go into the transaction that created that coding. And we have to follow it all the way through to whether it was paid out to somebody or if it came in on payroll. So we have spent a lot of time with the county doing these transactions the way they would like to see them reflected. So that's been a big output for us. We are also spending time working in OpenGov, which is the budgeting system. So the budget to actual pulls from OpenGov, and the amounts in OpenGov are not aligned to the latest version of our budgets. So we're working with our budget analyst on getting an amendment put in for 2023 to make sure that we have those numbers in there correctly. For indirect, I know I touched on this last time. We're getting some pushback from the county on how they want to handle the indirect piece in Oracle. And it's because we're the only department that has indirect. So we are pushing them to create something that the rest of the county won't need. But for us, it's important for our reporting. Let's see, I just touched on this, the last week of pay for grants is not integrated to Oracle currently. So when they started the new payroll system, they didn't have a plan for how it was going to get into the financial system. So we are having a fairly major hiccup right now. And I said in my first meeting yesterday, I have asked to be the public health advocate in that space, to sit in the county meetings. I have worked in other departments, including OFM, so I know some of the players there. So it helped me to have more of a voice in that meeting yesterday. The other thing I've spent a lot of time on is ensuring that all of the revenue and expenditures between us and the county have been recorded, first of all, are correct, and to see if there's extra monies anywhere that we haven't pulled down. The only reason I mentioned that is there's some funds like sales tax funds that we're working on what the balances are. Nothing will be changing for 2023, but we want to make sure we have the right amounts for that because some of that might be available in 2024. And specifically, Joe, that's for the mosquito district. So that's an area that I've been working with the county to determine what we can spend those types of monies on. So that's just a quick hit. We've been also working on getting new reporting. So I just pushed out some reporting this week to Lexi and Indira and Catherine to take a look. That will be going out to the division managers once we confirm that everything's looking good. One of the things we're also asking for is that it be broke out by these new appropriations. So it'll give us an overall look. You all could use it as well. It'll show you what's in public health 11, 12, 13, what our spend down is so far for the year. This is something that the other departments already had, but I asked for it to be created for us as well. So we just got that. The other two reports, we have a no projects report, which just gives us a kind of snapshot of what our general fund spend down is. So our own monies that are not grant related. So we have some reporting mechanisms there now that we're using. We just created a projects report. I think I mentioned this last time. It's up and usable. It gives us a budget to actual. So this first county's had this. We're still waiting on that indirect piece for that report. And then one of the things that my team is starting to use more, because we know now that the commissioners are looking in this one module in Oracle, it's called the budgetary control dashboard. So there's a public health dashboard and there's also the county dashboard. So we're using both those dashboards and are starting to rely on that a little more. That's all the items that I had for the system updates. Do you all?
I do.
Yeah.
So first of all, thank you.
Yes.
For so much work, and also thanks for advocating for public health in the sort of larger county conversations. Just to confirm, all of this work that you all have been doing to align us with the county system, we should be better off this year, right? I mean, in terms of like.
2024.
Right.
Right.
Yes. Okay.
Yeah, so we're starting, this year, we're starting everything with the PH 11, 12, and 13 in place for operating, where last year we are now backtracking to everything we did for the year and reallocating it.
So hopefully it'll make it easier on you all going forward. And also, I mean, and Lexi and I have talked a little bit about this. Part of our challenge in the last 5-6 years is that we've had so many people coming in and out of admin and finance that, you know, we had spreadsheets that were built by one person, the next person inherited, as you know.
Right.
So this will get rid of our reliance on one person's spreadsheets. Which is great.
Right. And then for OpenGov too, there is additional functionality that community planning and permitting is paying OpenGov for that we're trying to piggyback on that would give us a greater, we would be able to use OpenGov's features for our grants and our projects as well, which right now is why we're being pushed to the spreadsheet still for that.
Yeah.
Yeah.
Great. So, and I say that also just because some of my fellow board members have not been
They're new.
around through the last 6 years where we've had, I mean, this is how we got to the situation in the first place, right? That we had lots of different people in the position of building spreadsheets. So this should help clean it up and also make us just more sustainable in terms of being able to have our systems in place. So thank you. Thank you to your team for doing all that. My other question is about the indirect. Does HHS not have grants that use indirects? I mean, how is that not a thing?
They don't use Oracle. So they don't use the projects module. Yeah,
So why are we not using the same thing as HHS then?
because we don't want to hand track our items. So I don't know how many grants HHS is, so I'd be guessing, but I know that we have 90-ish. So I know community services has like maybe like 20, and that might be overstating it. Indira, is that about right?
Yeah,
Yeah.
Community services doesn't charge indirect. Instead, what they do is everybody is county funded. And then anybody that they bring in for grants, they actually build them into the grant rather than charging the indirect.
Got it.
But it would be really hard for us because of the federal regulations on time and effort and time tracking for 90 grants. Imagine this grant with this rate, you know what I mean? It would be like everybody's time. It would be really almost impossible to do that.
Got it.
it's our timeline again. Sorry, I'll ask you every
Timeline
for completing this work to the level that is acceptable to the county commission.
So our system will be closing for 2023. So our system is managed by the county.
Mhm.
So they're closing AP 15th, so next week. So that will be closed then. And then AR, we can accept, we have a period of availability. So everything that is for 2023 work that comes in before February 29th can be charged back to 2023. And then there's a different process that we go through after that. So I would say that by March sometime, the numbers will be more final.
Not just the numbers, but the
Yeah.
actual implementation of all of the systems.
The implementation of all the systems, I would say OpenGov, I expect to be the slowest because there's still some functionality that needs to be built to give us everything that we need. As far as the reporting, it's largely built, the things that we've asked for so far. We're just waiting on a couple of other items. I'm looking to see what else here we have. And I think the indirect conversation, like we were supposed to meet on it the last 2 weeks, but I think OFM is having problems, so they keep pushing out that meeting. So I'm hoping that that will be done this month as well. And the rest of the aligning of the, you know, the charges and the accounting should be done this month as well. So a lot of it will be done by the end of this month. Larger picture things like budget systems, I expect that'll take longer.
Thank you, Desiree. I also just want to acknowledge that while Desiree and her team are doing all of these things, the audit has also started. So they're also doing audit work at this time. Okay, so I'm not going to go over this slide. You've all seen this, but just to jog your memory, this is the phasing that we talked about with the many tasks in place. And you'll note the key up at the top is our way to track how far we've progressed. And you'll see quite a few of them in phase 1 and 2 are in progress. And so I wanted to talk about some of the work that is happening behind the scenes and in the weeds to do that closeout of the 2023. So we heard Desiree talk about system updates. Want to also acknowledge some of the work that we're doing just to close out 2023 in relation to our current financial state as we wrap up and analyze those also internal proposals that came in from teams on yesterday. So this includes reviewing our telecom, training, travel, parties, mileage, bonuses, and other operational expenses to focus on priority needs and if we need to make any policy changes. We have received and analyzed updated personnel data from HR to ensure an alignment with our financial need, as well as understand any new impacts such as retirements, shifts in FTE, and grant requirements. I will tell you that initially when we talked with the county about this switch and how it would impact us, that it would really mess with the salary component because that's all we had really been looking at. We hadn't been looking at operating. And that became even more apparent in the last few weeks when I shared this information back with HR and said, now these are all the people that you now have to pull out, because we had some individuals in the operating buckets where their salary was being covered. And they were very confused why now these additional numbers were being added. So I looped in OFM to acknowledge this is the ask that's being made of us, and they can provide you more details in this space. So we were able to clean up the overall personnel listing. The other interesting component related to that is when dimensions occurred, it gave us back a lot of positions. So we had 31 positions that we haven't had in like 4 years that came back on our list that we had to clean back out of our system.
There real quick, Catherine, because I think this is important for the board to know. You'll remember last year that we repeatedly got this question of what are you doing with all of your vacancy savings from one of the commissioners? And we said we don't have, because they were looking at sheets that had all of these historic positions that we had no intention of filling, had no money for. And that's the reconciliation that Catherine's talking about that we've been able to accomplish. So hopefully that conversation.
We are wrapping all of our 2023 grants, invoices, and reporting for tracking spend downs from original budgets for 2023 to understand programmatic use. And with the reports that Desiree is talking about, we're actually able to see trend lines now going all the way back to 2019 to really understand how much is needed in certain budgets. We are considering new fee shifts and revenue estimates that will come with components like the WTS that you approved, as well as with our vital records team. And then we are updating our fund balance approach in alignment with county shifts based on audit and GAAP principles. So there's a lot of behind the scenes work happening that's very in the weeds to get you final numbers for 2023 that will then prepare us for 2024. So you can see what we are estimating in terms of our available funds and possible cuts that need to be made.
Team structure.
Any questions, Wei?
Another one. No, I just, thinking about, it sounds, Catherine, like you all have been working in close alignment with OFM, because I think that's the other piece of this is making sure that we are singing from the same songbook as OFM. So all of our information that's flowing to the commissioners is consistent. Stuff like that is in a much better place than it was maybe a few months ago.
Yeah, I think we, especially last fall, became more aware of the things that our county commissioners were looking at. Thinking that we were looking at the same systems and realizing we're not. And also that we were working off the same information. And that's really that page 13 component. And we really weren't. And so this is our reconciliation time to make sure that all of those systems that they were looking at really read the same as what we see on our end.
And because again, just trying to understand how we got to this place in the first place about the misalignment between what the commissioners were looking at and what we're looking at. It seems like the commissioners started reading new numbers this year. Did they decide? I mean, this is a change from past experiences and interactions we've had with commissioners around budget. So do we know anything? I mean, it doesn't really matter how we got there, but okay. But again, just for us to understand the context of how we got to this place.
Yep.
It's different than any other conversation we've had with them in the past. So
That's right.
The other ones on those specific, like. Space. So when Jordan's computer is being nice to her,
Right? Okay.
then we will switch over to Lexi.
So I just have 3 slides, but it may take us a minute to get through it. And I want to make sure that we have time for the conversation after mine. What I'm going to do is do that kind of unpacking a little bit. I'm going to show you kind of what our fiscal cliffs are that we had been trying to plan for the next 3 years. And then I'm going to show you kind of how the funding cuts affected our 3-year planning strategy. And then we're going to circle back and Catherine's going to talk with you about kind of what the standards for setting reserves are in different places. To see if the board wants to have a conversation about creating an expectation for what our reserves should be going forward. Okay. Okay, so this first one is pretty self-explanatory. When we map out our fiscal cliffs for the next 3 years, including this year, and we'll soon need to transition to adding 27 on here. What you see is a little bit this year as we kind of transition out of COVID with a couple of other gaps. And then it's 2025 where you really see some big declines. In communicable disease and emergency management, the rest of our federal funding will be gone. There is actually an indirect deficit this year too, but it's already been programmed and set the numbers, which we are working on. The 2 big ones are family health and ARPA and MBH. The family health is mostly the Family Connects ARPA grant. So we're hoping that we have pathways to more sustainable funding there. And then community health also. And so that's a combination of, it's a lot of our MBH work is in that space. So it's possible that we could pick up some funding there if the ballot tax is passed, the behavioral health ballot tax is passed. But we're trying to be good stewards and plan and have backup plans and backup plans for the backup plans. So we are also looking, we have been working on like what's our revenue generation strategy, including additional Medicaid benefits, which if they come through, that would be great. There's some legislative supports that could support Family Connects. We may get the increase in per capita for health departments, which would give us another $400,000 of unrestricted funding a year, which would be wonderful. So this, I just wanted to give you a little bit of a feel for kind of what our funding cliffs look like, because this is what we were looking at when we were trying to preserve our reserves, right? Okay.
Do you have any projections for how much of this you could potentially cover?
I do. I don't have it on me, but we have lots of strategies and lots of places about how are we going to deal with this and this and this. And part of it depends on things like, is Medicaid a feasible way for us to generate some money, or is it more trouble than it's worth? How much would it generate? What are the categories that it could fund, et cetera? So there's a lot of, we're still working in that space. But yes, we are absolutely, trying to pay attention to what are the specific pathways out of these funding cliffs.
Can I just add really quickly that some of this is unfunded mandates. And so some of this may feel like it's a value add to the community, but it's not just that. It's actual unfunded mandates that we are required by state statute. So,
And I want to be clear, this does not include the funding cuts that we just received from the county. This is in addition.
This is your.
Well, and then Jared, to your point about unfunded mandates, because I do remember that came up in our joint conversation with the commissioners last year about can we quantify what that gap is? Here's what the mandates are. This is what the revenue for those mandates are, and this is the gap. Because I think that's also part of that conversation with the commissioners, right? Is this is what we are required to do that we do not receive funding from state for.
Yeah, and it's not a clear number because there's not enough money for them to fully fund all the unfunded mandates. But what we want to kind of try to develop is like, this is a minimum threshold. And in some spaces, we're not even meeting that.
But other county departments must be dealing with the same thing.
Absolutely.
So has there been any inter-county discussion, interdepartmental discussion about how can we put pressure on the state or our county budgets to have these covered? Like,
Yeah,
are there any
for instance, we're trying to,
coordinated effort?
yeah, so we're trying to have a conversation this year on increasing the restaurant inspection fees, which have not been increased for how many years? 6 or 7 years. And don't even remotely cover the real cost of doing the inspections. They may go up a little in 25.
I'm hearing from some of our neighboring counties that are a little bit more conservative, that they are actually wanting to see public health get these increases and can't believe that they haven't had these increases over time. So I am feeling hopeful, but we just can't count on it until it happens because you don't know what the final state budget looks like. I would say also, the challenge it puts us in with these cuts is it's really pitting unfunded mandates against all the equity work that we're trying to do. And we know that you need both. And so we are definitely feeling the tension, I think, between those two.
I just think the more that we can quantify what we estimate that gap to be between what the mandates are and what the revenue streams are, the more that helps us articulate what the needs are for the community to, for instance, the commissioners and what the county budget is. So even if it's not an exact number, if we have a pretty good idea of what that gap is, I think that's helpful. And it's helpful, I think, for the board to know what that gap is too.
And I do think seeing what that gap is for other departments is important as well. I was looking at the budget and you all came to me and said, well, we have a $3 million deficit gap. But then I look at surrounding counties and they are saying they have 400,000. I would want to know why. A state mandate.
Well, a lot of that 3 million is related to the ARPA funds, not all of it.
Oh, I'm just saying specifically.
Right. Okay, I'm going to keep us moving forward because I need to transfer it back over to Catherine pretty soon, and I have 2 more slides. Now, this is the explanation of kind of what we think happened, and it's going to take me a second to walk you through it. So what at least one of our commissioners was really focused in on was Oracle, the Oracle system and what it showed. And what you need to understand about Oracle is that it shows all of our funds, including our 5% reserves and emergency fund, which is 1.8 million, as well as unspent dollars that we may be trying to plan for other things. And so what I've kind of tried to depict here, and I'm sorry, I'm not a graphic designer, is this purple line across the horizontal purple line. Above it is kind of our reserves, and below it is what we've actually budgeted, right? Does that make sense for different categories? For our unrestricted funds, for county funds, for our restricted funds and grants, and wherever we're programming the previous year's reserves to go in. Okay. And when you look across 24, 25, 26, you can see, and those first blue and brown boxes on the far left are kind of what shows up in the 23 Oracle snapshot, right? And so what you see is that we have to always maintain that 5% reserves, and that we were planning to take those remaining reserves and kind of spend them down over the next couple of years so that we had time to build up new revenue sources, so that we were stepping things down gradually in a planned way, recognizing that, you know, it's entirely possible that we will contract a bit in the next few years, but we wanted to do it in an intentional way that was strategic and that aligned with our strategic plan, et cetera. Okay. Any questions on this slide?
So is the proposal then to maintain only the minimum required 5% reserve?
So that's what I'm going to show you now.
I do have a question before you get onto that. That 2.2 that was remaining reserves, and I think this is an important point of clarity when talking to the commissioners about this, because they were talking about that being leftover unspent funds. But that is not leftover unspent funds from the $23 that they put into.
No, that's all of our.
Right.
Yeah.
So, but I do think that they were counting that among this as you're sitting on this unspent money. So I think to be able to clarify that was reserves that we have been holding away as one, you know, who's acting fiscally responsible does. But it did not come from the 23 allocation.
That's right.
County.
Okay, so this is what we're looking at with the spending cuts. And if you'll just kind of pay attention to how much white space you see, which is the gaps. They're significantly more and faster, right? So we have gaps this year. We have no projected reserves for next year. Unless we are able to.
No projected reserves beyond the 5%.
Beyond the 5%. Well, we have to have the 5%, the 500,000 emergency. Yeah, and so that's, I mean, because we have to keep that, you know, you're seeing kind of where the cuts. Now, this does not incorporate potential new revenues. It's true. But those are hard to quantify right now. And maybe we'll get a better sense as we go forward. But the main message is that we have plans for those remaining reserves that were going to help us out. And we're being put into a position where not only are we spending enormous amounts of time rewriting our 24 budget and figuring out what the decisions are, but we have the opportunity cost. We were planning to spend this time looking for those new revenues, writing grants, and it's completely consuming staff's time. And it's a frustrating situation. So I don't know, does this visual work for y'all? Is it helpful and kind of depicting? I know, right? I need a graphic designer.
I think potentially putting the numbers in those blank spaces would be helpful.
Oh, yeah, we can do that. It's,
That'd be helpful.
and it's not exactly proportional, but I tried to give a rough estimate of the proportionality.
And
But I can do that.
And what is the rationale behind splitting the reserve? Like, what's the top white space versus the bottom white space? Maybe consolidating that.
They're just gaps. Yeah, because we weren't expecting that county fund gap to go from 8.5 to 7 million. So that's where it created a new gap. So I just arbitrarily said, sure, we can use. Some of those reserves are going to have to step into those spaces because those are not positions that we can cut. There's a lot of positions in the county funded staff, like my position. Are you going to cut me? Indira? Our division managers are all county funded. So it's like, there's a lot of, and then a lot of it's statutorily required. So it's like, this is why it's very difficult.
I completely sympathize and understand, you know, the frustration of being forced to spend all of this time on recreating the budget. But the county, you know, they showed us their numbers and they're upside down in 3 years. So this is an inevitable step. Like, the county commissioners need to be more fiscally responsible with the money that's in the county. And so I think, though it is very frustrating that you can't spend more time grant writing because you have to work on the budgeting, I do think that this is a necessary step, and I appreciate this being taken seriously.
Brooke, I agree with you that it's a necessary step. I think what was frustrating for us was that it was made in the 11th hour. with
Oh, totally agree. Totally agree.
And we're being treated differently from other county departments. And I have told the commissioners many times, we know we all are going to have to cut our general funds. We are on board with that. But we want to be treated fairly. And we would like the time for planning that everybody else is getting.
Yeah, I mean, I agree. That was very unprofessional and inappropriate to delay it till the very end with no warning. Totally agree.
And none of the other county departments were cut.
Yeah.
And it's 0.3% of the county budget. So
Yeah.
not really going to affect their
No.
general too much.
But I think I think the department will be ahead of the game because we know the county is going to have to make some drastic changes in the next 2 years. And so, though it is very frustrating now, I do think that you'll be in a much, much better position than some of the other departments when they start getting their cuts in the next 2 years. Because they're coming and they're going to be drastic.
And I hope so. And we're working really hard so that the work that we're doing now is part of a longer term strategy. And that's part of the complication of it, is that takes longer if it's a longer term strategy than if we're just saying, well, we're just going to have to do it for this year. Because I don't think we're going to have to do it for this year.
You're not just going to have to do it.
Okay. So that was my spiel.
Can I ask a question about the reserve? Because I think we had talked about healthy reserves being around 10%.
You are so good, Brooke. That's
So-
the next conversation.
Oh, okay, sorry. Go ahead.
Perfect.
You're good. Okay, so let's talk about reserves. Insight and standards. So first of all, what are reserves and why are reserves important? For a governmental entity, especially as compared to business entities or other types of organizations where they have stable funding or revenue coming in, reserves are really there to be used for one-time use. This can be for emergency situations. It can be for large capital expenditures, or even utilized to help start up a program. I would also share that historically, when I moved into this role 2 years ago, and even to this day, BCPH has utilized their reserves to cover ongoing costs, which is not sustainable. So when I got here, our reserves were roughly sitting at below 4%. We were slowly moving out of the cycle of spending on ongoing costs and rebuilding our reserves to be used for its actual purpose. So if you remember, when we signed our 2023 budget amendment, we were sitting at 11.1%. So we were building back our reserves and moving out of this practice of using our reserves for ongoing situations. But we knew there were things that we needed to kind of tie up before we could fully remove ourselves from that practice. So a thing I want to actually highlight is that the cuts from the county actually do show our reserves at work. So we were just getting to a healthy balance at that 11.1%. And that balance did allow us to help winter the storm a bit as we determined the necessary shifts. If we had been at, say, roughly that 5%, we would have been in a really drastic situation, making decisions that would not have made any sense at all. So part of the conversation that we want to have with you is needing to focus on ensuring that we keep a healthy reserve in place for future scenarios such as these. Setting a standard allows us to do this. So I wanted to identify for you some different entities and what they have highlighted as healthy reserve rates. You can see that none of them are the same. So the first one is Governmental Financial Officers Association. So this is a national group that really focuses on government finances. And what they acknowledge is that they suggested back in 2019 that a 16.7% was really what they thought of as a healthy reserves. The other thing that I would share, if anybody wants to geek out, because I actually am like pulling some data on this, but they have a whole slew of policies from local communities identifying each of their reserve fund balance levels and the use policies. So they have over like 25 in this database that shows what the reserve policies are. The state of Colorado bookkeepers, yes, I attended that training and it was super fun. In 2021, they identified a healthy rate as 11 to 15%. The Colorado Public Health Administrative Directors Committee, we did a recent poll and asked people what their fund balances are, and these are the top answers that we received. So you can see none of these are the same. One entity, these are all local public health agencies in Colorado. No less than 25% can be reduced for a one-time cost, but must maintain a 3% emergency reserve. Another entity said 15%. They are allowed to go as low as 10%, but must have a plan to restore to 15% within the year. And another one said cannot exceed 20% of their budget. Going into Boulder County, within their specific policies at the very top of the reserve area, it says budgeted at no less than 20% of total revenue. And then you see BCPH currently not to go below 5%.
I really should have known this. I actually thought the 5% was a state mandate. This is what is in our bylaws. Okay.
I also thought it was a state
Yeah.
mandate for all.
But if it is a requirement to maintain a minimum of 5%.
Oh, okay, it is.
By the state.
Yes.
Yeah.
But but we have nothing in our bylaws that indicates, do we have anything in our bylaws or we just sort of follow that? Yeah, that Jordan would then, yeah, okay. Okay, so it is a state mandate. We're just following the minimum state mandate at this moment in time. Great.
So now that we have this rough understanding of what different entities are telling us in terms of defining healthy, that there is no base healthy, but we see our numbers are, we go down to 10% and we're going up to roughly 25%. So we wanted to pull an analysis for you of what that would look like. So you'll see on the left side of the screen is the different budget levels. So depending on where our budget were to sit, and before COVID, we were roughly in that 19 million. Last year, we were around 27 million. Right now, we're estimating at about 26 million for 2024. And you can see here, when we go across the line, where that different percentage point would leave our reserves. Now, this would just be our reserves. This would not be like the emergency fund or other assigned funds that we have in our fund balance. This would just be what is remaining for us to utilize. A component that I want you to think about as you're looking at this is just recognizing again that when the county made their cuts, it was a little bit over $2 million. So thinking about where that would leave us if we had these reserves in place.
So Catherine, and questions about what are potential revenue sources for building back up reserves? You know, we can't use grant funds for reserves, right? And we apparently at this moment can't use county funds, which leaves state per capita funds. I mean, what are other revenue sources that we could put into reserves if we wanted to?
Yeah, so it would typically be fees, and per capita would largely be where those sources would come from.
Which is not, I mean, right now we're running at a deficit on our per cap anyway, and fees, as we said, there are minimal opportunities to increase fees. So we can set a goal and then it would be an interesting conversation to say how long it's going to take us to hit that goal.
And you know, Desiree and I have talked about that quite a bit, that we can set a number, but that doesn't mean that's going to happen tomorrow.
Right.
That means that we would have to work to get to that place, but it does help us ensure that one, we have healthy reserves to actually be able to fund the needs of our agency and where we want to go in the future. But also if situations like what we saw happen with the county were to occur again, we're in a better state and we can respond to it in a better way.
This is a new thing that we can't use county funds
Well,
for reserves,
and-
because that always.
Yeah, no, actually, that was my next point is that we have been using county for funds
So that's a.
to
new
beef up our
requirement.
reserves. Well, it isn't.
It's just a new reality.
there-
that we won't have the funds.
I mean, I think that's worth, again, I don't think the commissioners have articulated anything other than an expectation that we spend down all of our county funds every single year. And that's new and newly articulated just in the last couple of months.
And if that's
That
a
was-
requirement, then they're
that's-
definitely not going into.
And so
reserve.
this goes back into Brooke's previous question about like what, or your question, what changed, right? And so we started making a list of all of the things that were like, oh, this was an unexpressed expectation of the commissioners that they never shared with us that is different from past practice and took them where they were. We used to get a lump sum of money from the county and it was ours to do what we wanted with it. We didn't report on it. We didn't give it back. The salary requests were given COLA and merit, just like any other county employee. These technical issues about Oracle, that were agreements that directives from OFM, that turned out to take the commissioners down the wrong road in understanding what was in Oracle. And that apparently wasn't explained to them. The fact that taxes, sustainability taxes and HHS 1A taxes were approved by those department heads in June. And this year, the commissioners line itemed things out, including some things of ours. And so when there was so much stability previously with the county funding, and there wasn't kind of this intense micro look at changing everything at the last minute, county funds felt really stable to us. They felt like they felt more like per capita in some ways. And now they feel like a grant. And that's okay, but we weren't given the warning to make those transitions.
Lexi, can I?
Yes.
Make one comment. I just wanted to point out that across the county, when the county gives money to other departments, they're required to give back their excess at the end of the year.
They are, and that's always been the case.
That's always been the case.
Yeah.
So we have been an outlier in that way. But it seems like we're being held to that expectation now.
So we're expected to build up whatever we define as like
And that
reserves outside of the outside of the account.
I mean, I think that is a conversation we're having directly with the commissioners because they didn't say that. What they said was, we want you to spend down all your county funds. And so having a conversation that asks, can we use any of the county funding unspent for our reserves that we're trying to build back up? And this is why, because also if we have an emergency, it is not just our emergency, it's the county's emergency.
And I would imagine they would see this as more fiscally responsible to have more of a reserve.
But isn't this sort of a moot point if we're already looking at a budget deficit? Because it doesn't matter. The question is, where are we going to find funds to both keep programs running and pay people and build up our reserve? And if we're looking at a budget deficit, period, then the real question is, what are the department's priorities? And what are going to for sure be funded? And then how do we work into the reserve?
I think that's the immediate question, and Morgan's question is the
Yeah.
one.
And I think like just
Yeah.
looking into this year, when we're looking at spending down those funds, could we put any excess
I think
into our
that-
reserve?
I think that would probably be a bad idea, because if the county's reviewing our fund and said, well, you took our money, we gave you much more than you needed, so if you dropped in your reserve, I think that would be a very risky move without.
I think that's the
a
question.
direct.
I think we need
But I
to
mean, I
ask
think
that if we do align our budget I mean, we have to align our budget with what our new revenue level is, and if there is any difference in that that allows us to maintain, you know, so if there's any difference in that, can we put it back into the reserves, or do they want us to return all excess funds every year? And, you know, and I think it would help us to have that conversation if we had clarity around what our goal for reserves is too. So this is where we're
And,
trying to
and
get
what
to.
are, with other departments, what do they do?
The county holds the reserves.
The county holds.
So that's the
So
kind of.
the county has reserves for all the other departments.
So we're the only department
That holds the
that holds our reserves. Okay, I think that's the core issue.
Yeah, exactly.
I think that is the core
Exactly.
problem. So if we're putting county funds into our reserves,
And
in my mind, it would be equivalent to the county holding.
by the way, the county's target for reserves is 60 million and they currently have 90 million.
Yeah, so
Okay,
they're
so
sitting
it's-
on an excess.
They're sitting at excess.
Yeah.
Got it.
And Joe and I have been here and Heather a while, and so I would say, Joe, in the past 10 years, the reserves have always been around 10%. There's only one time that I've seen them go down. I think Jeff he was a little nervous about it, but it went down to 7%.
Like 7.5.
And I think it was to hire our health and racial equity position, but we felt like it was really important. And so he wanted to take that risk. Our emergency reserves were also at 200,000 prior to that, 250,000. When COVID hit, Jeff was very worried about not ever, because we could go through $250,000 probably in
Yeah.
I don't know,
Right.
a week. Yeah. So we boosted that up. But I just wanted to provide historical perspective to share with you that in the past, prior to COVID, that's kind of what we did. Is that right, Joe?
But I think this is the issue, is that we're kind of sort of separate and not exactly.
And we're held to a different
standard. Different standard to the other departments because the county, when you say the county has 30 million, is that all the departments pulled together?
90 million.
Yeah,
Okay.
every other department falls under that county
Gotcha.
organizing body.
So they're not, we don't know, are they held separately? And so
No.
it's not even.
It's a
No.
It's a lump
The
sum.
only other separate legal entity would be the Boulder County Housing Authority. So I don't know if you all have seen what's happening with them, but they're moving under the commissioners. They're going to report directly to the commissioners going forward.
And I have a question about that. Does the county hold their reserves for them?
I'm not aware of the reserve structure at the Housing Authority.
I mean, is that something we can ask for, that the county hold our reserves for us?
Well, I think that's part of that conversation.
Yeah.
So, you know, so if we set a reserve goal with what we think is a reasonable amount of 12%, let's say,
Mhm.
and then we say, you know, this is where we want to be because we think that's what's fiscally responsible. And will you allow us to take any unspent funds to put into our reserves until we hit that amount? And then once we hit that amount, we'll, you know,
Another
Give it back.
option is to just ask the commissioners if we can align with their reserves.
Mhm.
What are your reserves at any given time? We'll have the same standard.
yeah, yes, we could do that. We could do that too. I mean, I think that.
That percent.
Or the other question is, if you won't allow us to do that, will then you hold reserves for us so that if we have an emergency and that we.
But
have-
the risk would be, what would be the conflict of the,
Yeah, because I think that's risky.
how, yeah, it's risky if they didn't agree with.
Sees a lot of your autonomy.
Yeah.
Your autonomy.
Yeah.
The commissioners, which the state system set up the system on purpose to stay autonomous. I will be hesitant to do that.
Right, because then you are, you fall under the political whims of whatever commissioner is making the decision at that time. Now, but that also begs the question of, why wouldn't you see public health as part of your local responsibilities and, you know, what you provide your community?
Is this the structure?
I mean, this is a philosophical question. How do you take your?
I didn't want to speak to the fact that we do our own audit, so we would be required reserves. I do not think we can come in with the county.
Yeah.
We would have to change what kind of unit we are with the county.
Yeah.
Is this the structure of other counties and public health? Is the way that our relationship is with the county commissioners?
I'm going to pass this over to Catherine. She knows more about that structural setup for others.
So the majority of urban or Front Range are frontier or rural, you'll see more of them where their county will. But those are often local public health agencies that may only have 3 staff. So it doesn't really make sense for them. They don't even have the administrative type
Have their own
staff.
budget.
Yes,
Okay, gotcha. But along the Front Range,
yes.
the way that we're structured is similar to
Yep.
other counties.
A lot of it's state mandated.
Yep.
So the rural areas get, because they only have 3 staff, the state allows them flexibility. But larger areas don't have.
So in this space, what we are seeking is first of all, to really have standard of practice and have a well thought out reserve policy. Here we're giving suggestions. I would suggest that we don't go over 25, but that we don't go under 10. And honestly, if we think again about that $2 million cut that could occur, that really a 15% puts us in a nice healthy spot if our budget were to go down to 19 million. There are obviously different options that we could do. As we saw on the other slide, we could give a specific number. We could give a range. We could say, you know, we're allowed to use this much. We want to put this towards emergencies. The other thing that I would have you think about a little bit as you're considering where you want to go with reserves is that more frequently we have had emergency type situations come up, whether they're large or small, but there's no funding to help us do those things. And we do track time and we do track operational costs that we have, hoping that something may pop up, but it has been more likely than not that nothing pops up. So we end up taking on those costs.
What's been the lag of refilling the reserve after the use during an emergency? Or is that explicit? Like, what's your time frame for replenishing a reserve from reserves?
That's an excellent question. I would say in my 2 years here, I'm not quite sure. So
What we would do in the past was, we would expend the emergency, like what we need to use, and then that was set for that year. And then when the new year set, it was like a resetting of that bank account or that reserve.
You did the new.
Yeah, when you did the budget for the next year, then it was kind of a reset. So I'll give you an example. We just had that cold weather sheltering in Boulder. And the city of Boulder really wanted to have a lot of case management and have people on site. And a lot of our our communicable disease and emergency management folks are grant funded. And some of the grants will cover that. Our harm reduction staff was able to go out, they were doing harm reduction work. But some of our nurses cannot be billed to their immunization grants because they were going to support more like taking people's vitals, making sure that they were okay. So we eat the cost of that, or we have to use our emergency reserves to pay for that because we can't build that time and effort federally. The federal requirements do not allow us to do that time and effort. So that can happen really quickly. You know, we've got an active Neisseria meningitis outbreak happening among the unhoused. We've seen Hep A, we've seen like all of these things occur in our community all the time. Syphilis, exactly, right? So, you know, and there's only so many, the grants can only cover so much. And then, as Catherine said, the state won't necessarily replenish. So it's just something to consider.
I will say that there are moments when the county has helped more than other times, and it's not consistent. We can't get a consistent read on when they help us and when they don't. So,
And that would be my major concern with having them hold the reserves.
Yeah.
Because you wouldn't be able to act as fast in those moments where you have a cold snap.
oh, and I would hate for the board not to have the discretion to decide what is appropriate spending
Right.
for emergency.
I mean, I think the county has done quite a bit of investment also in the last few years around trying to acknowledge the need for more resilience, right? Community planning, resilience. Well, this gets at that problem too, is that if we don't have a healthy reserve fund, then we cannot be prepared for, and we know these emergencies continue and, are probably going to ramp up. So,
And you have to respond,
Right.
immediate in real time.
Right.
not be paused on getting access.
and the only thing
Well, we don't respond. Like, I
Right.
mean, those are some hard decisions that we have to make.
right.
Do we not respond?
Right. And so what we're talking about is updating our bylaws to include a reserve.
Or creating policy, maybe not bylaws, but we can create those.
Okay.
Reporting.
Because what I don't want to do is lock us into a place where like,
Yes.
oh god, now we have to cut staff because we
That's
went
that's
for
yeah, I don't want to risk like making your lives harder.
Guideline.
Because we have this expectation of some absolute reserve.
Yeah.
It actually cuts the budget
Okay.
further.
What would help you in that space? To help, like, would you like more rough templates of what other people put in their language, even what Boulder County has in their language? Okay.
I would like to see how other health departments, what they have, what their county departments have for their reserve funding, what is their language in there? Yeah, and I think it's hard to make this decision until we see some more information on the actual updated 2024 budget. It's because it's like everyone is saying, if we set it 25%, what does that mean when we have we don't know what the current plan is?
Well, but I think we could set an aspirational, like, this is what we want it to be, and that's part of Lexi's 3-year budgeting, right? So here's how we're gonna get
Put in
there.
some language about lead time. That's what I was
Yeah.
asking about was the time frame.
But it would
for
be, I think it would be
rebuilding,
nice if we
to
could see what other,
to say you have a few years to get there.
The only thing I would caution and suggest is that we do have language in place by the 2025 budget that we can lean back on and say, this is what we're working towards and where we hope to go with our reserves.
And again, I think we need to set that based on what we need, and then we need to have a conversation with the commissioners about, would you allow us to hold on to unspent funds until we meet that reserve balance?
Well, and it's also,
Yeah.
it's interesting to me that when they talked about unspent funds, they were looking at all of our reserves as if they have, like they funded over reserves as opposed to the county portion.
I see. So they were hoping we would spend they were
I don't
expecting.
think they understood. Honestly, I really don't. I don't think they understood that our reserves were part of that and that that is not part of what we spend on our budget every year.
Possible.
They might know that now.
I don't think that the reserves are reflected in the budgetary dashboard.
In Oracle.
Yes.
So what were they seeing then it's the excess?
just the unspent.
Right.
Okay.
So they did just do that.
I would have to confirm that, but that's a different series of accounting.
Okay.
In the past, did you ever explicitly apply county funds to the reserves or no?
No. No, it's a rollover. So just to give you a little background, reserves is revenue minus expenses. And either you have extra or you have a deficit. So whether it's extra or a deficit, that gets applied to what your reserve amount is for the next year. So we'll be doing that calculation soon for what happened in 2023. And either we will have had extra and that will be in addition to what we have in our reserves right now, or it'll be a deficit and we'll subtract from what we have in our reserve.
And the county fund years past were just put into that bucket.
It's just an
It was just a bucket that wasn't.
Right.
It wasn't.
It wasn't accounted
separated
for
out.
differently.
Separate.
Right.
I guess the challenge, I'm curious just reading your thoughts on this, because when I think about what we've just been through, like we just went through this huge increase in dealing with the pandemic, and we got all these grants, and then we were able to kind of increase our reserves because we had other funding sources. But as we come down and we see these fiscal cliffs, will it be harder for us to build back our reserves?
Yes.
Absolutely.
So it may be more than 3 years before we can.
It could be 10 years, but I think it's still worth the exercise of determining what you think that a healthy reserve would be and making that our goal.
I would strongly caution against having a discussion with the commissioners this year about putting unused county funds into a reserve, only because the county, because there won't be any, exactly. And so that we know the county budget is going to get tighter and tighter over the next 3 years, so it's not even worth, stirring the pot in that regard. I would strongly caution against having that discussion for a while. Maybe in 5 years, when budget starts to.
Well, I don't know. I do think, again, it's worth us having a discussion about what we think we want to have in our reserves. And then if we spend down all our funds, I just think that there is usually some sort of difference in what the exact spend down is, and what was budgeted, right? And there always has been historically. And so I think we need to explicitly ask. So what? I guess what's the risk? The risk is that they say, no, you can't put it towards return it all. Okay.
And then when they budget next year, they're like, wow, they wanted to put their spend down into their reserves. So clearly they can be penalized further.
No, but I don't think so, because the difference is they're gonna see what we have left over no matter what. Right?
Yep.
So it's either that we return it to them or they let us put it towards what our reserves for resilience is. And if they say no, like, okay, it's not gonna change what's left over. It's not like we're gonna rush out and spend that money.
I think it's a fair conversation. I would also acknowledge that we are 2 million under what we need to even fund. So if we were ever to get that 2 million back from them, then it would be a conversation where we could ask, could we keep some of it? But at this point, there is nothing to keep.
There's nothing to keep this year, but next year we're building a budget based on what our new amount of money is from them.
And I imagine that we'll probably extend that funds as far as we can go with.
Sure, right. There might not be anything next year or the year after. But
I'm not saying not have the conversation ever.
Be strategic.
Yeah, I would strategically delay the conversation.
yeah, I guess I know. It's up to you all, but that would be mine.
It's also actually up to you.
I'm not meeting with you, had the experience of getting my perspective directly, and I don't know, I think it's sort of the philosophical question, like.
Well, and I think part of where we got into these problems in the first place, Brooke, is that we didn't just ask them to be explicit. We need to beef up our communication with them and get real clear.
I agree.
About like, this is what you are allowed to use our funding for, and this is what's not, and this is what our expectations are. And so if we don't ask for clarity and also why they're thinking that way, then it's really hard for us to know.
I would heavily caveat it that this is not a position that we will be in for a while.
Yeah,
But
sure.
Should this occur?
Yeah.
5, 6, 10 years from now, would that be a problem?
I don't even think we have to ask the question until we have extra funding, right? And again, that might not be for a couple of years.
Yeah, that's what I mean, just delay the conversation.
Sure. I don't think it's a relevant conversation until we have excess funds, but when we get there, if we have the excess funds, get asked.
Yeah, I'm just saying not today.
Like, sure. Not leaving this meeting. Absolutely. Trying to schedule something. But I do think what we have learned is that we need to not assume business as usual. We have new commissioners and we need to ask them to clarify what their expectations are.
And that is on my agenda for the next PMI.
Yeah.
Yeah, and I think that even as the commissioners change, they're going to be under a lot of funding pressure.
Sure. So, what timeline on when you would like this sort of guiding policy?
I think we could probably provide just individual information to each of you, and then maybe at our next retreat, we could have it as part of the conversation. So you all have time to sit with it.
He's definitely going to want to lay in on it.
Yeah. And think about what it is that you may want to recommend or any language that you may want. And then we can start pulling it together.
Our next retreat is in May. I believe it's that first week of May. So.
When is it?
When is it?
What day?
Oh, I didn't know we had a date.
Fine.
Maybe I have one in my head, but
I haven't sent out the invite to, but I do know we had talked about. Was it not April? The one in April is an executive session for performance. I have not scheduled it for May, but I will circle back and schedule it with you all.
Okay.
Yeah, add that as a to-do.
Right, can we start this so we can get out of budget and talk about more fun things with Cal? Great.
Yeah, no, thank you. Helpful information, and again, helpful for us to be able to have more time to talk about it and ask questions. Thanks for all the work and then sharing it with us.
Actually, I have one more thing. So we switch over. So next week is our Board of Health meeting. Because you've now had a budget update. Is there anything specific that you would like for the Board of Health meeting next week? So that we're not giving you redundant information.
Even if it'll be redundant, even just a short update on where we are in the spend down, because even though this is a public meeting, that's just another public meeting. And I think it's important to have that as part of the public record, is an update on where we are in the spend down, what we're anticipating.
Yeah, I think being very brief is fine.
Yeah.
This was a long budget.
Yeah.
Thank you. Sorry.
Yeah.
Alrighty, so we'll move to the next item. I guess so I'll take a deep breath before. I know the budget conversation's never a fun one. And moving on to another really high priority topic may not be, maybe pretty draining too. So yeah, just take a deep breath. I have about 20 minutes to present, so I have my timer going. Hello, everyone, me again. So today we're gonna continue on the previous conversations that we had about racial equity in our agency, especially it being a strategic priority. And now that we have some new Board of Health members, we think this would be a great time, and rolling out the strategic plan with Kelly's leadership, that this would be a great time to kind of update the board on some background history, and then also really ask some questions about how can we support you, whether it's through providing resources, providing updates, or even providing some suggestions of how you want to be more involved in the work. That's going to be the bulk of our discussion today. Next slide, please. So again, the purpose is for the Board of Health to provide guidance on how they would like to increase their understanding and engagement in order to advance our HRE goals in the county. Next slide, please. So we're kind of going to chop it up into two main parts. The first part is just going to be some basic history and background. Of course, we could spend hours, months, years talking about history and background, but with the help of Lexi, she helped me kind of distill down some key points that would help y'all kind of understand the history and potentially the role of the Board of Health. And then also the bulk of the activity today will kind of be seeing the results of the Mentimeter, and then having more of a discussion about how our agency can best support you as well. Next slide. Next one. So in Boulder, I thought it would just be a good idea to share just some basic statistics. Even though we are technically a progressive and community-centered county, we still do have quite a few disparities. These are just some that I wanted to highlight. So a lot of Latinx, low-income Boulder County residents rank their personal health lower than non-Hispanic, white, and more wealthy residents. Latinx residents are more likely to be uninsured. LGBTQ, so this isn't including trans people, residents face higher rates of anxiety, depression, and suicidality. This is also true for trans and non-binary residents as well. There's also been a notable increase in hate crime incidents over the last few years. And there's also some large racial disparities in regards to educational attainment, income, as well as aflatoxin exposure compared to the rest of the United States. And of course, there's more, but these are just some to highlight that there is some work to do that our agency is kind of focused on. Next slide. So as you all know, we have the HEC, which is the Health Equity Coordinating Committee. It was founded in 2015. There are some champions and people that helped start it here in the room. It was created in order to advance our mission to eliminate health inequities in the county. So in 2020, the Board of Health, so this Board of Health and the county commissioners did declare structural racism as a public health crisis. So this was also, of course, following the data coming out of COVID-19, as well as the notable incidents with George Floyd and Breonna Taylor. Boulder County, the commissioners also adopted policy 1.6. So for those that are unfamiliar with it, it was a policy adopted by the commissioners to kind of create a vision of having Boulder County government to be a fully inclusive, anti-racist, and multicultural organization. So that if you look deeper into it, it's talking about addressing disparities, systemic issues, as well as barriers that get in the way of providing access to our communities. Our Board of Health also has a history of HRE champions. So we had a few community organizers be a part of the board, as well as, the board did kind of lead the county, if not a lot of municipalities in the country, of declaring racism a public health issue. So the next point is that several public health departments, as well as some health partners, so people that provide medical care or health services in Colorado, now prioritize addressing structural racism in their work. So it's not like we're alone in this work. If anything, we have partners locally, on the national level, on the state level, potentially even globally, to kind of advance this work. So why is this important, and kind of what does that mean for us? So it's a lot of really nice talk, but what does that kind of look like structurally? So investing in these kinds of priorities, or having these kinds of priorities in our strategic plan, allows us to increase allocation of resources to address health disparities. So additional funding, additional partnerships. It fosters alignment between health and community serving partners. So what are our local, national, global, state partners doing in this space? Are they coming up with initiatives, collaborations where we can partner and in order to help our community? It also helps to innovate research and engagement strategies. Of course, this work is heavily backed by data, but of course, data still needs to be improved, as well as research methodologies and analyses. So investing in this kind of work allows for researchers and professionals to really innovate in this space in order with good data collection and reporting. The last thing, it does report more accountable collection and reporting of racial disparity data. Next. So here are some examples. So of course, there's a lot going on in the county in this space. There's also, we like to call it, there's visible components to the work where you kind of see it, you can touch it, you can feel it. And then there's also that invisible component. So a lot of So internally, we are working on a health and racial equity framework. So similar to how our strategic plan is almost like the acting body of our work, how we operationalize it, so the hands and feet, we're thinking of the development of the HRE framework is more about the brain. So it's more about the context, the why, what is the data that backs it up, what is the history, what's the evidence, and then kind of like what's the HRE foundation in order to do our strategic plan goals. As a result, we've also had our HEC goals, so our 5 work groups, and their goals embedded into the HRE priority of our strategic plan. So by having, because usually a lot of the times those health and racial equity groups tend to be small side components to an agency's work, but us integrating the HEC goals into our strategic plan really highlights to the community as well as our staff that we take this work seriously. As part of the HEC as well, we do have a community engagement work group, but we've also highlighted community engagement to also be a very strong priority in the strategic plan. So a lot of that does involve health and racial equity and adopting a racially conscious lens to this work. We also have some amazing programs on the program level that have historically worked with marginalized communities. So this is nothing new for the agency, right? We have Family Voice, we have Genesis, we have Healed, the nutrition program, we have mobile home parks, the Environmental Justice Valmont Power Plant, and then also Oasis. So a lot of these work with LGBTQ youth, undocumented folks, young Latina mothers, or people just recently having children. people who are unhoused, and people that are low income. So just showing that, we do have a strong history of embedding equity in our work, but now it's really centering it and really fully investing in it. Next slide, please. So thank you for filling out the Menti results. So kind of the bulk of the rest of this conversation is going to be kind of, where do you see your role in this? How can we best support you? So of course, we all come together from really different knowledge levels and experiences of addressing inequities in our communities. Some people are really new to this. Some people have lived through this. Some people went to school for it. Some people come in and out for it. Some people have done this in their careers. Some people haven't, right? So we do understand that and recognize that trainings required for most government and health professionals don't often include health and racial equity, especially in providing more tools and resources and strategies to actually address it, right? You're probably familiar with a lot of trainings that talk about race or make you aware about disparities, but we don't have resources on the county level that teach you what do you do about it, right? So I'm a person in privilege, or I'm a person with a marginalized identity, or I have this kind of role. What do I actually do with it, right? There are also a multitude of resources and approaches. Of course, there's not one way to do this work. You can do it on the data level, financial level, community level. There's so many different frameworks and approaches and lenses. So that can make it really difficult and sometimes overwhelming to know, where do you start and how do you continue? What's the next step look like? And with addressing structural racism and health inequities becoming a really strong priority for us here, as well as with our partners and community members, we really want to make sure that y'all have the necessary resources, colleagues, and support that you need to help us champion that work. Jordan, do you have access to the Mentimeter? I'm also happy to share my screen. Or
Yeah, I'm gonna stop sharing these. It was a fun time.
Okay. So we'll just briefly review some of the responses to the questions. However, we do have three specific questions that we would like to kind of highlight and be the kind of core point of our discussion today. So let me go back to that. Okay, so the first question was, what do you say is your knowledge level? I kind of love the responses already, because no one really said expert, which always means there's room for growth, right? Even myself, I probably wouldn't say I'm an expert in this space, because there's always new data, new frameworks, new things popping up, especially when you bring in intersectionality, right? So this is great. And I will share these results with you all at a later time if that would be helpful. But then also this will help us kind of, maybe if we do this annually, quarterly, to kind of see if there's any improvements or other resources you need. I think this one got a little tainted by some management team members, so I'm not sure exactly where everyone's responses were, but it looks like most of them in the somewhat somewhat uncomfortable to the very comfortable spots. Of course, I'm not sure who said what, but I think this does show that people are ready to talk about it, but there also might be some need to really get some just shared definitions, right? Because a lot of people have a different finish line, or a lot of people have a different definition of what a health disparity or inequity is. So maybe there needs to be a little bit of ground setting there. So that could be awesome. And then especially, core concepts such as intersectionality and CRT. Looks like there's pretty general high level of interest in health and racial equity issues on the board. Do you feel like you understand our strategies and actions for advancing HRE? So it looks like about half the board feels like they do, but maybe there needs to be a little bit more focus, maybe some more updates or clarity about how we're doing that work and what the specific actions look like. And then how committed are you to us focusing on HRE? Love it. Everyone's very committed. Do you think BCPH is on the right track in pursuing HRE issues? Yes. And then of course, some maybes or not sures. And then, yeah, I really like this slide. I thought this was fun with the dots. What do you see as the Board of Health's role in advancing health and racial equity? So it looks like a majority of the responses were about overseeing some progress, so maybe some updates or kind of maybe guidance that y'all would like to give us, advocating for our racial equity work. So maybe that's in the community, maybe it's with constituents, maybe it's with other partners. Also, an active advisory role, so very different than a passive advisory role. So I really like that, kind of being involved in our processes, kind of being checked in with before we do make a decision. And then also building partnerships with other Board of Healths. And then, do you feel like you have all the resources you need to fulfill your roles? I know this was a pretty black and white question, but looks like a majority do feel pretty confident, and maybe, again, we need to do some ground setting, maybe for new Board of Health members or those that haven't brushed up on some skills and resources.
I mean, I'll out myself. I'm the only no on that one. Yeah, and I've been on the board for the longest time.
Sometimes it's like the more aware you are about something, the more like you say no, or you feel like you don't have all the things you need. So
Pretty typical survey experience.
yeah, so I can go.
Do we share?
Yes.
Okay.
Yeah.
I want Amber to have to be assumed as the don't have all the
shame.
resources.
Me.
Just a second.
Yeah, no. I think we're on slide.
21.
Yeah,
But you want to progress to that one?
I think we're on, slide 22. So again, I know we like kind of breezed through that really quick, but kind of the three questions we wanted to focus on, especially the results, are these. So one, do you feel like you understand our strategy and actions? What do you see as your role in advancing this work? And also, how do you feel like you have all the resources you need to fulfill your role? So with the first question, we always think it's nice to provide some suggestions or menu items to help you chew through. So next slide, please. So for the first question being, do you feel like you understand our strategy and actions? The majority of the responses were yes, maybe a little bit, somewhat not sure. So we did want to provide you, obviously these aren't like you have to do this, but things to kind of get your brain going or to get chewing into these conversations. So some items that we suggested are, would you like a deeper dive into the strategic plan, right? Would you like to see the individual HRE goals, the metrics, the timeline, what we're looking at, what we're specifically focusing on? Similarly, would you like to understand our HEX goals? So what does the HEC want? What is the HEC vision? What are they working? What are they working on? What's their capacity and the efficiency of that? Staff trainings. So right now our staff do have the option to take courageous conversation or beyond diversity. However, there are some issues in terms of it's offered on the county level and it's only offered a few times a year. So sometimes there can be a wait list. Sometimes not all of our staff have the opportunity to actually attend the training. It is in person. So maybe expanding our resources, learning about other trainings. I know Lexi and I are going to try to roll out some training guidelines or protocols from things like NACCHO and GARE. There's also the community engagement spectrum. So that's kind of a framework that is being used to inform our community engagement work. So how do we go from an agency that just takes and collects information to an agency that's actively empowering the community to do the work themselves? Would you like a deeper dive into what racial equity looks like in our program work? So I know I mentioned a few like Genesis, Oasis. So would you like to maybe see what stuff looks like on the program level? Also, we've identified priority populations, mostly Indira and Heather led that work, which was awesome, which still informs the county to this day. A lot of people use the work, I think even on the state level.
Yeah, it was a document they developed a few years ago that MDPH put out, and so it's used across Colorado.
Which is awesome. So yeah, so like more of the deliverables, the tangible stuff, right? Less about the talking and more about, what are some resources and tools being developed and being used. And then health and racial equity in our policy work. So of course, y'all know policy is a fun little sort of a game of chess. So where does racial equity kind of fit into that and what does it look like? Would you like to go question by question and kind of think about things, or would you like me to go through all of this menu items before we kind of hear from y'all? did you go back?
Yes, sir.
No,
I
no.
thought we.
So yeah, like that was the first question. Do you want to maybe share some reflections or thoughts?
Or ask your own question.
Yeah.
Yeah, sorry, Kevin, are you looking for us to ask for things we'd like to see more of in the future?
Yeah, so understanding that we're trying to build a rhythm of like incorporating our strategic priorities with health meetings and retreats. We just want to make sure that y'all are up to date. We also do recognize that these conversations can't just be done in one sitting. Sometimes it's a lot to process, to think about. Sometimes you need more planning or data. I think we had our first one was at our last retreat. This is the second one, and then maybe for our retreat in May, we'll have some updates. So kind of today, we're kind of sourcing some questions or thoughts or ideas that you have so that by the time we get to our May retreat, that we could provide you the resources that you actually. Yeah, hopefully that makes sense.
Do you want to go through the rest of it, Kevin, and then maybe we can have a sort of high level conversation?
Perfect. So next slide, please. Thank you. So kind of the second one, again, what do you see as the Board of Health's role in advancing health and racial equity? So a lot of the responses were something like, you want to oversee some progress, you want to have an active role. I believe, what was that? Advocating for our work and then also potentially building partnerships with other Board of Health. So these are again are from menu items of activities that the Board of Health may want to engage in. So I know someone mentioned earlier, like creating a common expectations of HRE knowledge. Like, are we all defining things the same? Do we have agreement? Sometimes you might be surprised colleagues you've been working with for years had a completely different perspective on something than you did, or had a completely different definition. So maybe making a foundational shared definitions agreement with the board. A value statement. So if the board wants to say like, hey, we're committed to this, kind of work together to create a shared vision on a social contract. So how does the board stay accountable to this work? How do we keep BCPH accountable? Who can we connect with in order to stay updated and maintain progress? Then also advocacy. Are there any skills you want to learn or to build in case you interact with constituents or partners? Kind of like how we do media spokesperson trainings, would there be some use of having trainings about how to talk about these topics with constituents? And then also engaging, leading to the next one, to engage in more of those critical discussions so you feel confident in those spaces, not like, oh, I don't know if I should say this or not, right? So those are some suggestions. Next slide, please. And then the last one, do you feel like you have all the resources you need to fulfill your role? Sometimes you don't know what you don't know, right? So some suggestions that we had that are already available at the county and also the national level. We have courageous conversations about race. There's also a virtual component for that. So if you haven't, it's already something that's offered in the county. So if you just want to know what training looks like in the county, what's the county talking about, what language are they using, that could be an excellent place to start. We're also a participant in the Government Alliance on Racial Equity. So it's this national group of government professionals, people focusing on racial equity. They also offer their own trainings and surveys that they provide to collect data. So does the Board of Health want to be involved in that? There's also NACHO. So they're working on a health equity and social justice training that we're going to curate for our public health work. So does the Board of Health want to be a part of that or take that training? Also partnerships with other boards, because sometimes there's 5 of y'all now. Like that's not a big group, right? So like, do you want to connect with other boards in the country, in the county, right? What are y'all doing? Are y'all having these conversations? Just so you have like-minded people and colleagues with similar roles. And then, also a value statement. Again, you want to essentially use a value statement as a resource for you to guide the conversations moving forward, especially knowing that board members, commissioners, people like that come and go. So do you want to create some kind of set infrastructure for future Board of Health members or current ones? I think those were the 3 main questions.
Others. Oh, it's just like a general wrap up.
Yeah, so maybe we could just, let's go to the general wrap up. So so what are some thoughts do you have? What information, ideas, concepts most resonated with you? Also, what doesn't resonate with you? Sometimes you talk to someone on the conceptual level and they're like, that doesn't really click for me. I'm more of a data person. So can you give me more empirical, quantitative, qualitative data? Some people like hearing stories or testimonies. Can we get some information about what's the community saying? Is this actually helping them? And then also, how can our staff support you? So of course, y'all have me, you have the director's team and management team, but is there more conversations you want to have and things of that nature? So yeah, I guess the floor is yours. I know that was a lot, but feel free to ask or comment interview.
Courageous conversations. It was the first year I was on the board.
Right, so actually, that's one of my first questions is there a minimum training requirement for staff? BCPH, having to do with HREs.
So right now, the minimum requirement for taking courageous conversations and beyond diversity is required for managers and supervisors, I believe, but nothing required for all of our staff yet. But that is something we are trying to work on with in the HEC work group, in the HEC Learning and Growth work group, because again, we understand the limitations with courageous conversation and beyond diversity because it's not offered a lot. So we're looking for additional trainings that might suffice for like a good onboarding or continuing education here. But nothing is required yet for all of our staff.
Well, because I think it would be great for the board to consider aligning our own expectations around trainings on the same trainings that staff are doing. So that again, like we're seeing the same things that you all are doing, are seeing in the training. So again, at least we have some common base knowledge and language. So I think that would be.
Yeah, I really like that. And I would say also that the courageous conversations and the beyond the persons really are about kind of the self-reflection and the self-transformation. And there's another aspect of doing health and racial equity work, which is like, how do you create change in the community? What are the actions a public health department can take to actually drive inequities down? And so balancing both of those might be useful for you as board members, so that you can see when you look at our programs, what's the strategy here? How is that connected to the empirical research? How, what's the rationale here?
Yeah, and I appreciate that, Lexi. I mean, I do think it's hard to embark on sort of the community level work without starting with the self-reflection, right? So it would be good for at least the board as a minimum to go through that self-reflection piece of it. Again, in alignment with whatever staff is doing, the expectations for staff. And then it would be interesting to see what other training opportunities there are that would help strategically about what's the role of public health and board of health. But at a minimum, at least starting with that self-reflection piece. If others have thoughts on that.
I think for me, what I would prefer would be more helpful for me is to see how it actually operates in practice. So when you talked about the program and policy piece, like what are the tangible products, tangible results? I think that's more helpful for me. I will say the courageous conversations training was quite a time undertaking.
There's one thing that I'm seeing that's affecting public health and racial equity right now, kind of ongoing in Boulder County, is the Medicaid disenrollment. And this may really fall, I'm just looking really at, it might fall more under HHS, but it strikes me in primary care that the Medicaid disenrollment has disproportionately affected monolingual Spanish speakers that didn't know and weren't contacted. And, I feel like the signs are not enough. I think the office isn't open frequently enough here. And I don't know that that's BCPH necessarily directly, but I don't know what more we can do to help re-enroll people. But it's the aggressive sort of disenrollment that's really impacting community health centers. And, I think that's a response to like the health of the community in general and everything, that it puts more burden on BCPH services, I think, when they're just more and more uninsured.
And that, yeah, that's a great conversation too. I mean, you know, I'm coming from Texas where if equity work was done, it was done in the public health department and it wasn't met. And here it's like you see departments doing equity work across the board. And so really getting a handle on like what's Boulder County Public Health's role
Mhm.
in the most important ways that we can support, not duplicate what HHS is doing, or maybe there's a leverage or add a value add or whatever. I think that's a great conversation piece for us going forward.
Yeah, because it will continue to have ramifications, the more people that are injured, and it seems just so disproportionate right now. That it's really affecting the Latinx community a lot more.
That is something we're focusing on both here in the department, but also on the county level. So there's a lot of community engagement groups. I know that we're investing a lot more in cultural brokership and investing in people that do come from these communities, because we do understand, like what you said, just posting a flyer or posting something on Twitter in Spanish doesn't really help. So you got to go to where the community is. I know we're in the hiring process for like a MB, mental and behavioral health cultural worker. And yeah, so like, I think these will be a great conversation, because I don't think this is just in public health's domain, but also, like you said, HHS. So like, what are our partners doing? How do we avoid redundancy and more fit the puzzle pieces rather than stack them, right? So yeah, I think that's a great point to bring up.
In terms of policy and lobbying, I don't know what can be done to expand Medicaid or Medicaid reform, but it's a problem.
Yeah, is that's on our policy agenda, right?
You know, the Medicaid reimbursed, like getting everybody enrolled, it's been a priority for the commissioners. It seems like they have done a lot of staffing increases at HHS to help increase. It could be that the strategies that they're using and leveraging aren't necessarily reaching the harder to reach populations, which is what we learned in COVID, is that you're going to have to do different strategies to reach certain segments of the population. So, but we could definitely share that with our partners. I know that I'm on those BCHIC calls and I hear the Clinica impacts, and the impacts on the federally qualified health centers have been pretty drastic because of this. So yeah,
And
I know.
it's a vicious cycle too, right? Because
now we can provide fewer services
Mhm.
than other fewer enrollment specialists at our health centers.
Yeah.
You know, it's just it's a downward spiral.
I was gonna make one suggestion. I see Kelly's hand up, but just real quick. And that is that I personally have found that doing health and racial equity work is kind of a private thing, and it's nice to have a buddy. We have done a lot of work in our community disease and emergency management division, and a lot of that started after George Floyd's murder, Breonna Taylor's murder, and a lot of that actually created conversation within the group, and it helped to drive a lot of our approaches in COVID to recognize who do we need to focus on and who do we need to strategize. So I just want to recognize and honor that you are a board who are being videotaped and available to the community. And so one solution might be to take some of the offerings that maybe Kevin has, or some of the things, and just divide it up or do small groups, because I know you can't meet without having just two of you or something like that, and just doing it together. Because I do think that it is going to be a lot of our work in the future. A lot of our work will be based in the racial equity, and that transformational change will require a board who is ready for supporting all of that transformational change. And so it's just a suggestion. So for example, we're in our division manager group, we're reading chapter 2 of Inclusion on Purpose, and just talking about the importance of inclusion in our teams and things like that. So there's a lot of stuff out there that we could support you with in having smaller, kind of less public facing.
Yeah, and again, like when this gets to that last question where I was the one that I didn't feel like I had all the resources I needed. It would be helpful again to understand what is staff doing to strengthen your skill sets in this work, and then what's an appropriate application for the board, right? So given sort of time restraints and schedules and all of that, what are the trainings that would be of highest value so that there's consistency? And also, are there other activities and skill building that staff is engaging in that the board could, with your help, Kathleen, build sort of a plan? Like, here's, what we want all board members, the expectation is that all board members do this minimum. And then here's some other things if you want to go deeper, or, maybe we can have that be part of.
It could be a HRE corner on
Right.
the PhD.
Oh, on that, excellent, yes, that's right.
Yeah, like I have a great article.
Right, exactly, so
Podcast
resources that we can share, or that you all can share with us so that we can deepen our understanding. And then the other piece that would be really helpful, and I said this to the policy team, is it would be helpful to know what you would like from the board. I mean, how does the board support this work tangibly? And so if you, and I think that's in your list on question 2, Kevin, you've had a bunch of your potentials, but it would be helpful to hear from staff. This is where we really think the board could add value, add support. Because you all are doing a lot of work in this that we don't know is going on.
Thank you for that. I took a bunch of notes and I want to hear from Kelly. If you want to share something.
Yeah, along those veins. So I think that some of this plays back into the previous conversation on the budget. And that is because this agency has been a leader in Colorado, and indeed, I think part of this country in some ways around the space, around health and racial equity. But it takes resources to do that work. And so when you start comparing the other LPHAs and things like, don't do this type of work, right? These are sort of things that I think need to be considered on some of those. When we look at our budget and what we need, and indeed, health and racial equity and community engagement are priorities for the county.
Although I don't think the county has any requirements for any of their boards.
Yeah.
Right? I mean, I don't think so. I don't think there's any training requirements for any of the county.
But for me, it's just understanding the space with in relationship to why we're not. I won't throw. I just go to public health in the Rockies and I face plant with about some of the things that people say in this space from that are in LPHAs about our size and things like that. And so I don't know. For me, it's just a thought about how we can. How we should view this is because it's one of our strategic priorities, and it's a big one. Let's fill across all our work.
Yeah, excellent point, Kelly. I think this is work that hasn't necessarily been done before. So a lot of the times there is a tendency to fall for like the bystander effect, right? Like, do we wait until someone else does something? Do we wait till someone else makes a declaration? And oftentimes we might just be the lone rangers or like the only one doing it, right? So it's also navigating that. This can be very isolating work. People often will look at us and be like, look at these weirdos. And then 10 years from now, they're gonna be like, oh, yeah, I was totally in support of that the whole time. Like they were right?
Well, and that's actually the trajectory that often happens in the Front Range is that Boulder County leads on something. They also feels, okay, if they can do it, we safe all of a sudden.
Exactly. And then also, like, I know the board comes from a wide variety of backgrounds and like expertise. So honestly, whatever you're interested in, there probably is a racial equity or racial component to that. And then on the flip side, in the racial equity world, like any topic that you bring in would be informative of doing that work, right? So also like what inspires you, like, thank you for sharing, like you really like data. I'm a big data person. Sometimes I just roll my eyes in some of these like workshops where it's just talk about race and feel bad, Yeah. Well, it's really about, like,
Yes, I don't want
to. How you get out of that brain bubble and go into the act, like I'm actually doing work. I have proof I'm actually making progress, and it's not just you're talking to the choir or you're screaming into the void kind of thing. Like, how do you start moving to the action space? So yeah, I appreciate that. So anything that kind of gets you inspired or jazzed up, please let me know, and we could totally integrate that into a training protocol or something. Yeah, but Thank you all.
Thanks.
Oh, yeah, no, please, go ahead.
Sorry, just listening and taking in all the ideas. Thank you. First, every time you come and speak about the work that you and your colleagues are doing, it makes me excited. I really like that first slide where you talked about how like HEC interacts with all of the different programs, right? Like HEC is like health equity isn't a standalone program, right? It really should be touching all of the different programs. And I think one of the things that would help me is as we see the different programs presenting, I would love to have like, and how this touches health equity, right? In really, really anything that we're doing, even in our budgetary discussions, right? Like we should be stopping and saying like, and how is this touching our health equity work?
Yeah.
So that would be helpful to me. That would be a request of mine. I recently went through like a values clarification or a values statement session with another organization. It was really a powerful experience. I love the idea of the board going through that, but I'm curious, like, does CDPHE have a value statement around health equity? Like, does CDP, like, do we as a department have one?
I don't know if they have their statement. CDPHE like is the one with the different work groups, right?
No, but they are starting to require some equity-based information for grant applications. So they are starting to say, what's the racial makeup of your organization? What
Of your board.
of your board? So they are starting to integrate it into a lot of the grant applications. I know that Denver Public Health has a equity statement. They have a framework that they have, and we've talked about that. But I really like what you said, Amber, because it's a culture shift.
Yeah.
It's everybody's responsibility. It's not just us. It's all of ours.
Yeah, I think reminding us when we're talking about the individual programs, right, it should all intersect. I think that if, as a board, we go through like a value statement, like I do think that it informing a bigger framework would be really important to me. And so I don't want it to be just a statement, right? Like I want it to be like applicable to the work that the department is important to what you're doing. And so I would hate for us to do that as a standalone work thing. You know, I would want tax involvement in that. So that would be an exciting exercise for me. My question was like, how do we interact with other boards of health? And so you gave me a resource for that. Thank you. That was very helpful. I would love to know what the staff is doing. Like, I want to reach out for two, like, what are the questions? So, oh yeah, it's good. Keep up to date. Like, what you guys are doing. You talk about like sitting in your book groups. Like, what is it that you guys are doing for like external education? I'm here for it. My question too was like, we have to follow the grant funding at any given time. Like, where is the money? And I'm assuming that there's money for this right now. Is this like a timely issue in our grant opportunities? Do we know this?
In terms of grants,
One of the biggest opportunities in grant work right now in this kind of a space is the connection between health and racial equity and moving into community engagement and community power building. And actually, Heather just led a grant writing process to submit a proposal for just that. Didn't you?
No, I didn't.
Yeah, so it's kind of, it's. I think the other space where there's opportunity for us as Boulder County Public Health is because I sit on the National Association of City and County Health Officials, Health Equity and Social Justice Work Group. And we're rolling out this Roots of Health and Equity course. We're talking with them about, you know, are there opportunities for us to provide demonstration in training materials on how you operationalize what people are hearing in the course. And because we, as a public health agency, have such an amazing history in this work because of the work of people like Heather, we're in a perfect position to provide some perspective on what does it look like when we try to do it? What are the lessons? What's really hard? What's, you know, what do you come up against? And so that's actually part of what we're talking about in our work group. But yeah, I think there are opportunities, but they're kind of, they shift a little.
They shift. You have to follow them. Yeah, they're a little while. I think that might have been my last question. Thank you.
So no, thank you all. I think Kelly's gonna.
I was just gonna add with this is like, you know, when we do the strategic plan, we have like key goals, objectives, indicators, which also builds that platform off that HEX group, which allows us to also look at other funding opportunities and be able to have a base, which a lot of places don't.
Yep.
Already helpful.
I mean, I think we went through a values clarification exercise. That's good for funding as well, right? Like to say as an organization, we've strategically prioritized it. We've on it.
Especially for filling out grants.
Yeah.
It's like Board of Health said this, it's like, yeah, that'd be awesome.
For sure.
Yeah, but thank you all so much. Jordan, hopefully.
No, you're good. Like so the next section is the bylaws, and when we were planning this retreat, the bylaws was at the very beginning, and through switching everything around, I've been able to update my bylaw slides in this meeting. Finally, things that we can talk about. So I sent you all a copy of the bylaws. They haven't been updated since 2021, which at the time was fine because everything was still virtual. But as the board has developed, I've been marginally 2 years, there have been more committees, more reporting, more more involvement overall. And so I just feel like it's time for us to start instituting like an annual review of the bylaws. Nothing has to change, or we could have drastic changes. All of this would need to be in coordination with our county attorneys. Obviously, Kate Haywood is on call right now if we have a question. But I don't think we need to make any decisions today. This is just a prompting conversation. So within the Board of Health membership section, it lists all the powers and the duties of the board. We can potentially add some language that was in the Boulder County, the commissioner's memo that we drafted last summer in preparation to bring on Amber. Don't have to, but that's just a thought that we had at the start. We're drafting all of this, this documentation, start incorporating some of it into our bylaws. In the president's duties, it lists out they are an ex officio member of committees. So like Catherine going to book papers, I read Robert's Rules of Order, which is a parliamentary document that this board abides by. And the ex officio is that Morgan could technically be on committees and it wouldn't count towards our quorum numbers. So I reached out to the county attorneys. Unfortunately, Colorado open meetings law trumps the Robert's rule. So they suggest we remove that language just so there's no misinterpretation of that. Lexi can still serve as ex officio and if she needs to hop into committee meetings, but the president would not count as ex officio. And as you're reviewing this, if there's any other clarifications that we need, it lists Lexi as the secretary of the board, but maybe we have clarifications that's kind of me and like as the Board of Health liaison. So pulling some of those out, since my role I feel like has grown in the past couple of years, and then talking to my predecessor, the liaison role has just grown a lot. Adding some trainings. We were just talking about that. So you all are required by CDPHE to take your annual Board of Health trainings. It just came out for 2024. So adding that language into it. And then maybe mention additional trainings as needed. So those are those health and racial equity trainings or anything else, the bookkeeping, that's really what you want to do. But not like pigeonholing us. Yeah, you do. Not pigeonholing to like, here's all the trainings you have to take, but leaving the language more flexible, but having it in there. So as new board members are brought on, they understand the expectation of it. And then the last one is just general update. So it still lists the auditorium and 3450 Broadway. Removing some of that location and putting it will be noticed as properly because we've been here. Now we're at the Justice Center. Maybe that changes this summer. So just being really flexible in that situation. Also reviewing all the hybrid information, just making sure that, I feel like we're fully into hybrid mode. I don't think that's going anywhere. And then job title corrections. Sometimes it lists health director, sometimes it lists executive director and just director. So just general cleanup. So those are my suggestions to start out with the bylaws. I see some head nods. Love it. Okay. So this will be, I have a Word doc version. I can go in and make those suggestions and see if the county attorneys have any other language to pull from other bylaws. But this is just a starting point. And the next slide that I had is some of guidelines that we want to draft. So like I said, like we've had lots of committees and subcommittees formed ad hocly. I don't know if that's a word, but very ad hoc nature. So maybe having, a more standardized approval and like standing up of a committee that has guidelines that need to be report backs, just kind of building in that structure, not including it in the bylaws, but just having a guiding document.
The next one is rules of decorum. So this is where we transitioned from fully virtual to here, not allowing the public in, and now we're offering it up to the public. I've drafted rule language to like enter into recess if we feel like we need to step away, but do we want to draft more formal rules of decorum? Anyone that walks through this door, you abide to acted this way, you know, respect and things of that nature. I pulled the city of Boulder City Council rules of decorum as a starting point. We haven't needed that because no members of the public have shown up, but just to have it in our back pocket in case. And the last one is to draft of reserves or like financial policies and guidelines. So just bring any other ideas or, yeah.
Well, I think all of those are great, and I think following the county's rules of decorum, we could probably just. That's something.
Does the county have, you said you pulled the city.
City of Boulder.
Does the county have rules of decorum? I do.
I don't know.
I know.
I know the city of Boulder, they like read them out each time.
Yeah.
Boulder County, they may have them like plastered.
No.
I'm not sure. Right.
But I noted one thing in here when I was reading too, that the president may limit the comments.
Mhm.
And maybe I was just am recalling at least one board meeting, maybe more, where we went till 10 o'clock allowing for it. So maybe we could put more explicit language, like if we know it's gonna be a big public response for something, to just limit it to 30 minutes total, and that we can individually read other submitted comments, but just in the interest and respect for everyone's time.
Right.
Those were not in the interest of
I think that was the meeting right before I started. There was like 300 people signed
Yeah,
up.
it was a lot. And so I just think maybe saying, you know, the first, if we're giving each person 3 minutes and not changing that, just say like the first 10 people signed up can speak.
Okay.
And everyone else needs to submit written comment.
And I think the city also has some language, Jordan, that might be helpful because they have changed their civic engagement rules around public participation and limits.
Yeah, I'm not looking to limit the public
Right.
interest, but I also think it's not realistic.
Yeah.
Necessarily, but should that ever happen again, which maybe it won't, but.
And I've also started, this is something on my end. I know during COVID, people could submit public comment requests up to 5:30. I backed that up to like 4:30. Because you're driving in, so how can you read these written submissions at that time?
I think that's good.
So that's something,
I would even say 4 o'clock.
okay, yeah.
Because otherwise it's not fair to us or the public.
Right.
City.
Although they can send them
Anytime.
after that, they can send them
Yes.
whenever. So if we're reading them, we can read them anytime.
But if they want it, do those comments go in the public record?
Yeah,
Yeah.
all that is.
If they want it included, that, I think that's very reasonable.
And this is an ongoing conversation, so I can still pull other stuff. NALBA, so National Association of Local Boards of Health, they could have other resources as well. But these are some of the things that I've realized in my 2 years that the board has shifted. And I think we need to have additional guidance on it. So I can pull resources kind of like what these two are doing, and maybe we set up a committee, a more formalized committee to set up committees. All right, great. That's all I really had. It was short and quick. I know we do have time for wrap up. We have 22 minutes left. Just to remind you, next Monday is our Board of Health meeting. You should get that packet Thursday or Friday morning. It's going to be at the Justice Center, and we will have at 5 o'clock. You're more than welcome to come early. We're going to have our Rachel and Christina's team for the sugary drinks. They're going to have a little welcome reception at the beginning. They're bringing in restaurant guests to come in who have signed up in Louisville to participate in the program. So you're more than welcome to show up. We have a little room reserved by the actual training room. Come and mingle. It's been approved by the county attorneys. And then they will present during the meeting the letters that Morgan and Lexi are signed. We'll kind of like that thank you letter. And then they will exit and have them go back and have another reception. So you're more than welcome to come early and join that.
And we have to be virtual
Okay.
again.
Okay.
Airport shuttling.
Okay. Sounds good.
As well, depending on the situation.
I'm trying to make it
Okay. Okay, sounds good. Anything else?
No, it just, really, like, can't overstate how helpful it is to have you keeping us accountable to all these things, because I think that that's so busy.
And the
SharePoint,
is it good?
Lovely.
Is it working? Okay.
very helpful.
Yeah, no, it just, and keeping track of, where are we out of alignment? What do we need to update? And
Yeah.
having a single place where we can go to tap into all of this information is huge. And so really appreciate all the work that you're doing to keep us in line.
Yeah, and chats with Tammy, my predecessor, the board has greatly changed. And so it's fun. That's the part where I'm like, I want to build it out the way we can use it. So Kevin, I make an HRE corner on it. I love it. Yeah.
Did I miss, what are the next steps? Are we like, how are we helping you with the revisions or?
So what I will do is pull some examples from county attorneys or other ones. That way we're not having to draft them. We can go in and edit. I have a red line version already going with those locations and just updates that I see. And then can't share it with all of you, but maybe we can identify a couple people who want to also see it from the board perspective. So I do want to have, and you would have to formally adopt it in a board meeting. So that's probably going to be like May or June or something, just based on timelines. So yeah. So no really next steps, but if you keep reading the bylaws and you see something else, just message me.
Cool. It's now a good time to say that I have this vision that maybe we might expand the board at some point.
I thought that was actually the discussion we were having when we brought up the bylaw.
I know,
Well, maybe.
this is
people in it.
Yeah. So I'll plant that seed.
Just curious why.
Well, a couple reasons. One is that I think that we do have more committee work that we're doing, and so it would be helpful to have more human power on to get a lot of this work done and to be able to go deeper into some of the things I think we want to go into. I think we are demographically narrow board at this present moment, so it would be great to expand the representation of this board. So that's thank you. Initial thinking about why it might be helpful to have more. Well,
Yeah, I think if people are willing to put in the time for committee work, that expanding.
yeah, and right now, I mean, a quorum is sometimes harder for us to get to also.
So would you expect
small.
like 7?
Yeah. Yeah. So I mean, again, it was meant to be a planting of the seed.
It is legally required. We would have to get Board of County Commissioners since they appoint Board of Health members. So there's like other like logistics. How is the staggering of the terms, things of that nature. But I do have contacts of like other LPHAs who have more than 5. So I do have that.
Because there's no state mandate about the number of people that we would
As
have.
long as it's odd, it's not,
Yeah.
it's like,
Right.
It's guides, but yes, at least 5. You have to at least 5 members, so.
Yeah. And is it a state mandate? It's not, right? I mean, it's individual, our bylaws about what the terms
Yes.
are. And that's another. Years, oh my God, it's a long term. So it's something else to think about too. I mean, what is our ability to recruit?
Well, I know the city just went through this very lengthy discussion around terms for boards. I think the biggest argument around keeping a 5-year term is because if the turnover is too rapid, like I can say it took 2 years, I would say, to come up to speed. So if you only have a 3-year term, then you're immediately turning over. And even if you come from another board, not all boards are equivalent, so sometimes.
Right, but then if you are able to renew for a second term, then you can serve up to 6 years. I mean, 10 years for somebody to be on the board.
That's
And
long.
Greg was on here for 11. That's a long time to have somebody on board.
But then you're hoping that people reapply after their 3 years, you know?
Right. No, right. So, and if it's not the right fit, then you also don't want them to stay around for another 3. So, I mean, I think that's the idea is that we could explore shortening the terms.
I think I saw in my initial research, I don't want to speak I can't remember. I know it's like down towards Denver, but they have 2 members that are 5 and 3 that are 3.
Oh, yeah.
So I don't know how that works
Yeah.
logistically. But I don't know if that was like planned or if that was like a revamp or.
I think that's true of a couple city boards, actually, that they vary sometimes, what the city board commitments are from the city of Boulder anyway, so.
Like presidents and like, you know, if you're serving in like a officer role, it could be extended.
And you apply for a 5-year.
Yeah. So just, you know, again, it's not something that we have to decide in the short term, but thinking about what are our needs as a board and how do we strengthen the board and. Yeah.
Now it's time. We have 15 minutes left.
Wow.
Anything? Yeah, I'm good on my end. Yeah.
Yeah.
Yes, you can just get us the proposed dates.
Oh, yes.
Yeah.
Will do.
Very.
Vacation. All right, well, yeah, we're gonna take your 15 minutes. Go enjoy. So thank you, everybody. For interrupting and